That was really nice. All right, question?
So self-healing.
Yes.
So that's AI doing self-healing, correct?
Yes. Actually, I don't think I'm gonna be able to.
That's okay.
Go
No,
back there,
that's
but,
okay.
So.
Well, let me ask you the
Oh, yeah,
question
sorry.
first. So, okay, assuming that it is AI doing that self-healing, it seems to me like even now with prompt engineering, you can challenge AI to challenge itself.
Mhm.
You know, to look for inaccuracies, look for hallucinogenic responses, to provide alternative, strategies and things. Have you looked at how effective that is? Just with the prompt engineering for trying to address some of these issues that you were pointing out.
So I didn't look at it that specifically because I was looking at it specifically in the medical field.
Sure.
And there's no evidence of actually, I'm sure someone's using it or testing on it right now, but no public information about them actually using or testing of that. That would be interesting to see like how regular AI or like generative AI uses that and see if that can be applied, but I didn't actually look into any of that.
Hannah, can you go into the differences a little bit more between the systems you're looking at and like the generative systems? Because I think
Like
that,
public and
just like,
the,
because I think that probably plays here with the question that is being
I
asked.
think I know what you're asking,
Yeah.
if I'm getting it wrong. So from my understanding of it, so let's use ChatGPT for example. You can ask it whatever you want, you can put whatever you want in, and it kind of talks back to you. While like these AIs for like medicine and stuff are very strict on what you can do with it. There's very specific things you're allowed to do, and it doesn't really let you veer out of that. Say like radiology, you can, like radiology imaging analysis I'll go with. You could only like look at chest x-rays or things like that, and it would only analyze that piece, and it wouldn't take any other information to be like, fix this or change this. It won't let you do any of that. It's very like strict on what you're allowed to do. Okay.
So once these are working, they've been trained on actual data, right? Are they feeding back in the errors that they are making once the program goes live?
No, this is a closed system opposed to, should I go with open system? Open systems, you can continuously fix. Closed systems, you cannot fix unless you pull it completely offline and then do like a revamping of it, so it's not feeding information
And are the
back.
companies doing that while it's still being used?
As the companies I looked up aren't doing that. Like you can't, like it's not feeding like this graph or like an image, go back through, here's the result. It's not doing that. It's you just put the image and the result or whatever in, and then it gives you that result, and then it just stays there. Is that what you're
So
asking?
if I pull up that skin, and it says skin cancer,
Mhm.
right? And I treat, and then I realize it was wrong. There's no mechanism right now for me as a doctor to go back and tell the company like, hey, I put this in, I got this back. Like that's not being done.
You can tell the company and they'll like gather stuff and they will probably pull, like if there's enough issues with it, they'll pull it offline and then revamp it, but they don't really have it online and continuously revamp it while it's online. I will say I'm not sure if every company do that, it's just the companies I look at do that. Martha?
So can you ask your doctor if he or she has used AI to come up with a result
Yes, they're actually supposed to ask you for permission.
before they do it?
Yes,
Before they tell
not
me
that
it's
they
skin
do it every
cancer?
time, but they're supposed to ask permission if they're using artificial intelligence within it. So on the safer side, I would ask of like, are you using artificial intelligence?
So for example, if I get a radiology result back, will the results say informed by AI, or do I just assume it's the doctor's opinion and not a computer opinion?
Yeah, it's supposed to say like when they use AI and like it's supposed to say.
Okay.
I can't guarantee they're actually putting that on there.
Yeah,
So it wouldn't hurt to ask them like directly to double check and like make sure.
thank you.
Devin?
So you went over medical biasness like for a little bit, but I was like curious with some of the so like kind of solutions that you gave. How would we keep medical biasness out of AI if we're bringing in a bunch of folks who do possibly have like medical biases in the case of the committee? And how do you keep like medical biasness out of like AI completely?
Yeah. The reason why I say mitigate is because you can't keep it out completely, because we are still human and we're the ones training it. So it's not, you're not able to completely eliminate it. You're able to like manage it and make it less than its like currency. I don't think there's a way to completely keep bias out of it because we're the ones training it, we're the ones giving it data. The hope with the AI guardrail committee is there's enough people that they'll be combating like opinions and like views on the world that will help solve or like mitigate and reduce the bias within an AI.
So it would be giving it a wider perspective.
Yeah, that's pretty much what it
Oh,
is.
okay.
It's kind of like ethic committees type deal if you remember that. But, yeah.
Wait, so guardrail committees are involved in the training part of the process?
The concept and training.
Is that a requirement, are guardrail committees a requirement before an AI is introduced into hospitals?
No, that depends on the company and the company they're working with. So they don't always use that. The person I talked to, Dr. Deborah, she or her company uses it, and they only have about 1,000 hospitals with them, which is a very low amount in the grand scheme of hospitals. But every single company in like hospital is not required to do this.
Do you know if the AIs that they're training use those committees show the same rates of bias as other ones?
As far, I don't remember like a specific article, but I do remember it does show like a lower rate, and it helps manage those issues quite a lot. So it's like kind of like reducing that bias within those systems instead of like enhancing them. I hope they're not enhancing them. If like, that does happen, that would be completely opposite of what they want. But like compared to like ones that don't use it, they probably have higher bias, but it's also hard to tell because they're not evaluating for bias at all.
But we are seeing evidence that
Yeah.
that system does reduce bias.
Yes, it like reduces bias and like helps mitigate it and helps solve that issue a little.
Well, for years and years, of course, our research has been biased, maybe not including women in a lot of the research. It's men or certain ages. Have you found in the research you're doing that you can ask AI to show you the bias of research that they're pulling from? That this study, this is the answer, but if you factor in that they didn't include these biases.
No, I have not actually seen that.
Okay, I'm
That's
just
interesting though.
curious,
That'd be
yeah.
interesting to look into. I didn't even think about that.
So like the women's health,
Yeah, health initiative.
So, like when it comes to like the lack of women or like lack of like people of color,
Mhm.
it does affect these systems because it's gonna treat you differently. I would say not like based on your skin or like gender, but you do have different requirements like biologically, I would say. There's like different things to go into that, and if it's on more white male patients, it's gonna do that based on their like diagnosis and like their symptoms, and it won't transfer over to be like, oh, a woman has these symptoms for the same disease, but it looks a little different within them, so that does affect it. I don't know if that answered really your question, but.
No, I'm just curious, it'd be wonderful to have AI look at our research that has been biased forever and kind of calling it out. And I don't know if they can even make an extrapolation from that, because women present differently than men for heart attacks.
Yep.
So, I don't know, it opens such a wide parameter.
That would be an interesting thing to look into. I actually have not seen anyone do that, or like in my research, I haven't seen anyone do that.
so now you've got a PhD thesis.
Just keep going with it.
We probably have time for one more quick
Yeah, we're at
question.
9 minutes.
Yeah.
You can take it if you have already.
I have kind of a two-part question. The first part of it's really short, but is there a situation where a patient like wouldn't see a doctor at all and only speak to AI?
There are situations like that, and those situations usually don't end up well.
What are the implications of that, like not having a patient-doctor relationship?
The implications of that, it uses a lot of compassion and human empathy, and also there's also been the issue of AI telling you the completely, what it sounds like is you're talking like generally AI, like you were asking that, it has the issue of just being completely wrong because it's just pulling everything from the internet and giving the wrong diagnosis, and also it's very difficult to get treatment if you're going through that.
I'm gonna steal one more real quick. You mentioned training, what exactly, when you say the humans are training the AI, what do you mean by that statement?
Like, training methods, like that?
Yes, you said humans are training the AIs, so our biases will carry over. What do you mean? What do you think humans are doing with AI when they build it?
So when you're building AI, it's like the code system, so there's different types, I didn't go like super deep in the coding and stuff, but like different codes, when I speak about training more specifically, is like the data sets that are being used for AI to analyze what's going on in a human, of like, does it have this disease, or does it have this illness, or is a bone broken, things like that. And it gathers all those data sets, or like, I would say cases or information on that, and putting
That's
that
good enough,
into the AI.
But we're over, so I'm gonna cut you off
Okay.
there.
All right.
I got what I wanted to do that. Thanks.
Thank you very much, Hannah. We're gonna ask you to step outside for